Today, I have a client on I am seriously excited about. Joe is a home health physical therapist already on track to earn in the top 1% of the entire profession, according to the data from the Bureau of Labor Statistics. And he's not even in one of the highest paying states. But here's the real kicker. Joe is a brand new grad. He landed the job before he even got his license. So we've got a lot to break down. Joe, thank you so much, man, for making time. I'm excited to have you here. Why don't you kick this off by just giving us a little history of your background?
Sure, of course. Thanks, Zach, for having me. First of all, a little bit about me. I'm in North Carolina, and I went to East Carolina University. I just graduated physical therapy school back in May. I had a few months to study for my board, so I took that at the end of July, and then I just started my first home health job in kind of the end of August, beginning of September. So far it's been a really good experience, and I'm excited to see where it takes me from here.
Yeah, so end of August, start of September. So you're like 5 weeks in or something like that.
Yep, that sounds about right.
Okay. How's it been going?
It's good. I think it's definitely one of those things where you have to learn as you go. Something that I don't really feel like I got educated a lot on in PT school was home health. I think in PT school we might have had like one lecture about home health. And so I really knew that this was something that I wanted to do, but I didn't have as much education on it coming out of school. And so I spent a lot of the time over the summer being able to prepare for my boards, yes, but also to be able to learn more about home health, things like PDGM and documentation and all of this stuff. And so far, it's been good. I've enjoyed being able to hustle a little bit, but also having some flexibility with everything.
Yeah, man, and like I was thinking about it, like we had been talking on Instagram for a hot minute, like a year.
Yeah, yeah, at least. So, kind of a little bit more background about that. I I knew early on in PT school that I didn't want to go to kind of like the traditional route. And I found that early on. I had a clinical instructor during my first rotation in the acute care setting who had been there for 15 years. She was great at her job, but it was very obvious, even though she didn't try to make it seem that way, that she was burnt out, underpaid, wanted more time with her kids. And so I quickly realized that I wanted something different. Having kids of my own and wanting to be able to support them financially as well as just be present in their lives. I set out to find different things, and that's kind of when I came across your page and everything that you did with home health. And so, yeah, we've been talking for it was like end of year one, beginning of year two of PT school. So it had been over a year, maybe a year and a half.
Super cool. And yeah, man, like you've three kids, right?
Yes, have 3.
So to anyone who watches this and says they don't have time or whatever it is to like learn a new skill, get into home health, whatever it is, even if it's not home health, whatever it is in life, like if it's important to you, like it was important to Joe with three kids, with studying to take the license, with learning home health, with getting the job, there's time. It's just a prioritization thing. And man, you mentioned you're hustling. Like I know you are. It's so apparent. And I love seeing it for you. I like genuinely like loved when you messaged me. It fired me up. I was so excited when you sent me that message.
Absolutely. And a big part of all of that too, I have to mention my spouse. She's an incredible support in all of this. And so you talk about wanting to learn something new or pursue home health or anything that you do. I think it's also important to have somebody in your corner, whether it's a spouse or a friend or a parent or something. But being able to have somebody who's going to cheer you on even when it's tough, because it's not always sunshine and rainbows getting to that point.
100%. Nothing in life is.
Yeah,
And that's good that you had her and like supported your mission. Super cool.
yeah, absolutely.
Well, since you were a new grad, unique perspective, like can you walk us through kind of what the interview process was in getting the current job you have?
Yeah, absolutely. So I think I really put a lot of time into trying to decide where I even wanted to apply to begin with. I was very picky with it. And the reason being is because what I learned in my conversations and from the things that you taught is that not all home health agencies are created the same. There are some that have an abundance of patients and an abundance of opportunities, but there are others that don't. And so, you and I kind of worked together and you helped me figure out what agencies had the most patients and would be able to actually help me fill my schedule. And then you also helped me learn a little bit more about the different payment models because they're a little bit different than the traditional outpatient, acute, things like that. And so I learned the difference between salary and pay per visit and PRN and all of those kinds of things. And I ultimately ended up studying that I wanted to um, pursue opportunities that were pay per visit so that I could be compensated for the additional work that I put in. Because another clinical instructor that I had, always had to work and hustle and grind, but he also had to make sure that he clocked out before his 40 hours were up, even if he was still in the office. And that's something that resonated with me is that I wanted to be compensated according to the value that I provided. So I sought out some pay per visit opportunities with home health that had lots of patients and as concentrated area as I could find. And then I applied. And so the home health agency that reached out to me actually hadn't had a position filled that they were looking to fill for over a year and a half.
Wow.
Um, and so, I think sometimes we think that there's not enough job opportunities or anything like that, but the market in physical therapy is very open. There's lots of needs, and there's lots of people who need physical therapists. So I was able to kind of use that a little bit to my advantage. You taught, a little bit about being able to know your value first, but then also being able to negotiate that. So when I did have that interview, I was given a certain level, but I was able to actually negotiate that pretty significantly. And so that's been a big part in me being able to get a little bit higher pay. So with you know all of that saying, I when it comes to trying to find the job that I wanted to apply to, I wanted lots of patients in a small area as possible with good pay, and wanted to be able to do that so I'd have more efficiency to be able to treat more patients and get paid more and have more flexibility and things like that.
Yeah, and it's the secret to being done at a reasonable time so you can spend time with your family as well, of course.
Absolutely. Yep.
Well, very cool. It's funny, I mentioned when I was kind of introducing you, I looked this up right before. I was like, what is the top 1% of? And like you are in the top 1% according to the data of 2024, whatever I quoted, the Labor Bureau. Like, it's crazy, man. New grad, you're not in like a crazy high reimbursement state. You're not in Northern California. You're not in one of these states where these rates are like super high. And so
Right.
by negotiating like that and by finding an agency that had a lot of patients, you were able to see good amount of volume. And with the model that you selected, which I love, I mean, you're having some crazy compensation.
Absolutely.
Um,
Yeah.
you shared this with me when you messaged me, but how much are you on track to make your first 12 months as a physical therapist?
Yeah, so with the current volume of home health patients that I'm seeing, I will be looking somewhere between 13K to 15K a month. And then with that home health, um, the flexibility that comes with it. I've been able to leverage some side hustles and to be able to build a business on my own. I think I told you it was around 6K. That was about a week ago. Now I'm looking closer to 8K.
Wow.
So it's growing and getting lots more opportunities. So I guess that range of 13 to 15 plus 6 to 8, it would be like 19 to 15, but 19 to 23-ish, something like that.
I was doing the math on my pink calculator here. Yeah, so I mean the 13 to 15 is 156 to $180,000. And
Okay.
then with the flexibility home health allowed you, you're able to do, did you say another 8,000 a month right now with your side hustle?
Yes.
8,000 times 12, that's another 96 plus 180 is what we just said. Yeah, I mean, pink calculator, $276,000 as a new grad home health physical therapist.
Yep. Absolutely. And that's, I mean, there's nothing special about what I'm doing. I'm not like providing insanely extra great quality care or anything. I just found a system that worked. And the side hustles that I've been doing are all of a sudden growing as well because whereas before if I was in a clinical or something, I'd have to hide in the bathroom to send a text or something. I did that many times to be able to message people or make something happen because you can't pull out your phone or anything like that. But now I can do it, whenever I need to. And so yeah, it's been good.
I laugh, man, because number one, that's just hilarious. But number two, when I worked in the outpatient clinic, seeing up to 20 patients a day, at that time in my life, I was like really into stocks. I was like day trading.
Yep.
And what you just said is exact. I would go in the laundry room and I would call my stockbroker and I'd be like, sell this thing. Like, and then I'd see the patient walk in the door and like the front desk person seating them. And I'm like, we got to do this right now. I got to get back in.
Yeah.
So I know 1000% what you're talking about when you said that story.
Exactly. I do some day trading as well. So I would have to run in the bathroom, sell this or check it and it shouldn't have to be that way. We go through 7+ years of school, get doctorates. I shouldn't have to hide in the bathroom to be able to send a text message. I think that's just ultimately kind of ridiculous.
Yeah,
But
that's the other thing I remember from that era is all my friends were like on, what was it? I'm aging myself. Whatever the Gmail like or the Google chatting platform was, and they were in text groups and stuff. And I was like 7 a.m. to 4 or what was my other 10 to 7 p.m. I was locked. Like no friends, nothing, not picking up my phone, not
yeah,
checking. I was locked, cranking volume for a clinic, and I was cool to see a lot of patients, similar to you. But like you, I wanted to go to home health because the model felt fair that if I'm going to see all these patients, paid per visit kind of compensation, like at least I feel that I'm compensated for it. So I mean, I totally understand why you went with the model you did.
one of my one of my rotations didn't have windows. And all my clinical instructor could talk about all day was how excited he would be to see the sun. And I'm like, what are we doing? So that was another reason too. Just the lifestyle behind some of the other more common traditional models was just not what I was interested in.
Wow.
Having the flexibility. Today I was able to help, my wife and kids with a car problem and still get all my appointments done. I'll do some more documentation tonight that I didn't finish, but my kids will be in bed and I've been able to see them. And that versus being excited to see the sun is just not no in no means comparable to me. I'm so grateful to have learned more about home health and be in the world of it.
It's crazy, man. I wonder how many years that therapist stays in that dark, dark room too, and just 3% raise, no raise, just sticks it
Yeah.
out, which is it's a sad story and it's the typical story in our profession, which really, really sucks. And I'm so proud that as a new grad, you went the different direction and like Dude, 276,000 divided by, I mean, 75,000, a lot of therapists are making. It's 3.6 times the compensation. I mean,
Yeah.
so awesome. So awesome. Um, I know you kind of brought this up earlier. Schools didn't prepare you really for home health. You had one potential lecture or something on it. You know, I hate when schools and therapists say you need 2 years experience or you need experience before you do home health. You got into home health as a new grad, you're making more than 99% of PTs, regardless of how many years experience they have. What would you say to anyone that says you need experience before doing home health?
I think that no amount of experience in a different setting is going to make you any more prepared for home health. I think if anything, I think I would prefer to have done it this way with getting into home health, because I still have all my clinical skills and things fresh. And I think it's just kind of silly to tell new grad therapists that they can't they can't do it because they need to learn how to do documentation or they need to learn how to be more autonomous. Um, when a lot of these new grads just passed the hardest test of their lives, went through doctorate level neuroscience classes, like they've done hard things and they're able to do it. And it's just a little disheartening to me because I can't even talk about some of the stuff. That I was working on, that I was looking into with classmates or professors or anything like that. It was just so taboo to want to do anything different than the norm, despite crushing amounts of student, loans, and I don't even want to get into all of that. But I think it's as a new grad or to somebody who says you need more experience. I think it's more than anything just a roof that we've put it over our own heads. In the agency that I work with, we have nurses, we have speech therapists, we have occupational therapists. None of those other professions are talking about how you need to have more experience before you go into home health. I don't know what it is about PT, if we're just worried about the liability or whatnot, but if you have the clinical skill set that you've received from your doctorate or just PT training, and you know how to think critically, communicate efficiently, and you're not afraid to ask for help. If you can do those three things, then there's no reason why you shouldn't be successful in home health.
Super well said. I love hearing that. Cool, man. Well,
Yeah,
Joe, man, I'm so happy for you. You're absolutely crushing it. Keep doing what you're doing. Thank you so much for your time today. And as always, man, I look forward to talking soon.
of course, Zach. Thank you so much. I appreciate you.
For sure. See ya.